Perfect. Well, good afternoon, everyone. I bring you greetings from Hartford, Connecticut. My name is Denise Octavia Smith. I'm a community health worker. I'm a patient navigator. I'm a survivor of a rare chronic disease. And in November 2019, I had the great honor of becoming the founding executive director of the National Association of Community Health Workers. I'm so grateful that you've decided to spend some time with us today. I see we have over 127 individuals. I want to welcome some of the founding board members of NACHW who are with us. I want to thank all of our partners who will be introduced throughout the day, as well as the presenters. Thank you so much for your partnership, your allyship with the National Association. Bernadine, are there a few slides for me to present here, or should I just sort of voice over my comments?
You can go ahead and just voice over. It's just a couple slides on the document center.
Perfect. So I'm going to get out of the way quickly because this is an exciting webinar, and I'm so thrilled with the presenters that are going to be with you today. But I would be remiss if I didn't take the opportunity to say it is because of you, our members, our partners, our allies, that the National Association of Community Health Workers has had such unprecedented growth and opportunity to advocate on behalf of my peers, my colleagues, my elders, our workforce across ethnicity, across geography, and across sector. If you are a promotora, a community health worker, a community health representative, a peer, an outreach worker, any of the dozens of titles that comprise the lived experience, the qualities, the competencies, the community trust that we consider as foundational to the definition of our workforce. I just want to thank you for the last year, for your service to community, for your response in the midst of a pandemic and racial protest and advocacy. I want to thank you so much for all the work that you have done for your own self-care and to advance your state and local associations. If you're a leader of an association, thank you so much for the support, the mentoring, the advocacy that you are providing to your members. And NACHW, we want to be a partner. We want to better understand your assets, your expertise, as well as ways that we can support. So please, our doors are open, our arms are open. We're a very young organization, but we have a big vision to be united so that we can advance and sustain this workforce. And the presentations that you are about to see are in pursuit of that same goal through the assessment of our workforce, through understanding our capacity, career pathways, our training, all of the infrastructure that supports our workforce, we can truly come together and maximize the times that we are in. I think that everybody knows that the Biden-Harris administration has signaled unprecedented investment in public health to the tune of over $7 billion. This is a great opportunity for us to unite nationally. And we have got to understand our capacity. We've got to articulate our roles, and we have to advocate together to respect our workforce, to protect our workforce, and to partner with our CHW networks, associations, and coalitions. Again, let me thank Bernadine Mafugu, who is our senior marketing manager. She's really the host for the day. So I'm going to step out of the way and I'll be saying hello in the chat. Again, thank you so much to each and every one of you, partners and members, old and new, for your participation today. And all the best to you. Stay safe.
Thank you so much, Denise. And now I'm going to pass it off to Carl Rush, who is going to be taking us through this day.
Thank you, Bernadine. Thanks, Denise, for the intro. Appreciate that. Next slide, please. This webinar is brought to you in effect by the Document Resource Center at the National Association of Community Health Workers website. And it is available. I'm going to be talking a little bit here at the beginning about the nature of this, but the nature of the Resource Center. The sort of feature presentation towards the end is going to be about a report that is just being released, the Resource Center. I wanted to take this opportunity to put that in the context of how people actually do this work. And so we're very, very fortunate to have wonderful presentations by two of the key user groups for this resource center, namely CHW leadership and state health departments. Many other folks are likely to find the resource center useful, but it is in the larger context of supporting the efforts of community health workers and their advocates and partners in advancing policy, mainly at the state level. My name is Carl Rush. I'm a policy advisor to NACHW and am working on this Document Resource Center project. The Resource Center is accessible from the homepage, the NACHW website. It's under the policy menu at the top of that screen. And we will make the link, which is on this slide, available to you. Next slide, please. So a quick summary of a few minutes here on the history of the Resource Center and the nature of it. And we will come back to this. Our project manager, Caitlin Allen, will be talking briefly about the user interface and how to utilize the Resource Center. But this began with some work that a number of us had done in partnership with the CDC related to the development of policies around community health workers at the state level. And I'm happy to report that journal articles on these two national studies will be coming out. Please look for an announcement from NACHW of this, but the main reports from these two studies will be coming out in the next couple of weeks. But the reason to establish this is a searchable database of documents related to advancing policy around community health workers. And a number of us who have been in this field for a while have been bombarded with questions like, how did other states deal with this issue, like certification of community health workers or sustainable financing? And the documents in this resource center have really two purposes. One is to document how state level groups went about developing policy, as well as documenting the decisions that they have reached. Next slide, please. And there are a number of different categories. There are a number of topic filters that are available to use, which we'll talk about later. But these are the main groupings in terms of the numbers of documents currently in the database. There are about 800. We're in the process, in fact, of adding about another 200 more recent documents to the database. Next slide, please. And these are a wide variety, from legislative bills to fact sheets and one-pagers and meeting agendas and reports of various kinds. A small percentage of these are not even really available on the internet. Where they are, we do provide the link, the URL to the document in the entry for that document in the database. Where we are able to do so, so long as it's not copyrighted, we do have a PDF of the document in the database available to download. But as you can see, there are a lot of possible things to look at. You can look at meeting minutes, for example, determine who was involved in particular kind of decision in other states, that sort of thing. Next slide, please. So we also want to be clear, just to make sure that everyone has realistic expectations, that what is not in the database. For example, the Association of State and Territorial Health Officials, or ASTO, and the National Academy for State Health Policy have maps and tables comparing the state of policy development in individual states. As you can imagine, it's a big challenge to keep that kind of information up to date. So we're trying to collaborate with these two organizations to help them keep their information more timely. It's also important to note that we do not include materials in here that are intended to help individual CHWs in your work. In other words, reference material about, let's say, educating individuals about diabetes management, that sort of thing. That is not part of this database. There is an array of documents related to training and defining training standards and so on at the state level, but we do not include specific curriculum materials from training programs. There are a lot of them out there, and it would be a big job in itself to try to just catalog those. So we do not have, and NACHW does not, as a matter of principle, endorse specific training curricula. There is a lot of information about recommended training practices and that sort of thing. One of the other areas of interest where there have been a lot of inquiries from people around the country is around the question of what the best available evidence is of the impact of CHWs in terms of outcomes and cost savings and things like that, as well as what are the best practices that employers should follow in employing CHWs successfully. We recognize the importance of that and the demand for it. We don't have it yet, but we are seeking funding for an expansion. We've already begun the design process to develop an expansion database, including those types of documents. And we're very excited about the potential of making that available to you over the next year or two as we can. Next slide, please. So this is what the main page, the landing page as we call it, of the document resource center. And we have gone to considerable effort with the help of a very diverse work group of interested parties in trying to design the user interface to make it as friendly as possible. And you'll hear more about that later in this webinar. Next slide, please. And there is, for example, I just want to highlight this one thing, that there are instructions about how to use the database, but we have also embedded a video showing a user working around the database, getting to search for a specific category of documents. And so we welcome other suggestions as to how we can improve the user experience in the resource center. But that's the essence of it. So without further ado, we really want to talk about, in the main topic of today's webinar, the subject of conducting an actual assessment of the community health worker workforce. And we're very fortunate to have two wonderful presenters for us. We are going to let them introduce themselves, But for the first presentation, next slide, please. I want to introduce Catherine Haywood, who is a board member of NACHW and also the chair of the Louisiana Community Health Outreach Network. And she has had considerable experience from the point of view of a CHW leader in conducting these kinds of assessment. So I would like to turn it over to you, Catherine, and welcome.
Thank you. Hello, everyone. Carl said I was going to introduce myself, but I think you did a great job with that. But I am the Executive Director for Louisiana Community Health Outreach Network in New Orleans and a member of NACHW. So this first slide, you see a whole lot of names on here, but they're here for a reason. LaShawn and LSU work closely on workforce assessment in Louisiana, and so I did not want to leave them out because it's important to acknowledge my partners. Next slide, please. So this is about leadership assessment. Next one, please. All right. So we here in Louisiana decided we needed to figure out a way to build a CHW database. So with LaShawn and LSU, we identified CHWs, we identified CHW programs and employees statewide. We did a web search, followed up through with phone calls and emails. So they had 82 sites. We were able to reach 152 CHWs, 56 supervisors, and all in all of the 9 regions within Louisiana. Next slide, please. We were able to, out of that, come up with the Louisiana CHW workforce study. And so the survey, we launched it at a conference we had. We sent to all in the database respondents, 65 CHWs, 37 employees, descriptive statistics. I can't talk today, forgive me. We did interviews, sample of the database invited participants. So we had 21 CHWs, 15 employees, audio recorded, transcribed, coded, and applied thematic analysis. Next one, please. So out of all of that, and I'm hoping you can see this, the highlights of the surveys was 54, and I might not be able to see it, but anyway, 54% African Americans, 22% whites, 11% Hispanic and Latinos, Latinx, 9% Native Americans or American Indians, and 3% Asian and Pacific Islanders. So out of that, we looked at the income, and so the income was somewhere between $30,000 and $40,000. We, the average age of CHWs and whatever was 43%, female 68%. And so 88% work full-time, and I really can't see the other one, but it's 81%, and please forgive me. 35% do not have a degree. And so it's okay, 22 graduate degrees, 31 bachelor degrees, and 11% people didn't answer that particular question. It really came out to like 5.7 average years of experience that people had. We looked at top employers, top population served, most common activities, top client referrals, referral types, most common team members, and top health condition address and training CHWs have received. Next slide, please. So in our findings, quantitative findings, we had certain themes in the knowledge of perception of CHW roles. You can see this, we had CHWs are advocates, need for stakeholder education. And these were comments made from the people that we interviewed. You know, of course, they said, I think there needs to be an understanding of what this community health worker role is and who is part of it. That's from the employer. And of course, the CHW advocate, advocate for what is important to the client that I work for. Advocate for improving their health. I give them resources and I promote their health. That's from one of the CHWs we spoke with. Next, please. The second one was workforce challenges. And of course, there's a lot of challenges, not just here in Louisiana, but I'm more than sure it's all over the country. So CHWs need more professional support. And then, of course, lack of sustainable financing, which is a big thing. Even with all the money that, as Carla Denise just mentioned, like $7 billion coming down the pipe, is it sustainable? And so that's a big question that we're always asking and looking to see how we can make sure that happens. Next slide, please. Workforce development. So CHWs and employees, because here in Louisiana, we do not have certification. We have standardized training, and that was supported by both CHWs and the employees. And there's a reason for that particular one, simply because there are a lot of barriers for good people who can be wonderful CHWs. And so that's the reason for that. I'm not sure if I have a next slide, but we can see, there we go, I did. Concerns about certification. And so we had gatekeepers that know their community better than anybody, who would come up with a certification training, who's never done outreach, who's never engaged the community. And then they're the ones that's putting on the standard or what it should look like, and then never step forward in any community at all. And that's a comment from one of the CHWs. Next. So actually, do you have any questions? And I know this was really, my speech was supposed to be like 15 minutes long, I think, but questions, please.
Kayla, do we have any, Carl, do we have questions in the chat addressed to Catherine's presentation?
Yeah, hey there. I'm not seeing any questions, but that's a good reminder that if you do have questions, to please use the chat. Since we have so many folks on the call today, it would be great to see the chat function used. A couple comments, though, that we need to make sure that CHWs are at the table and helping make support in these decisions. There is a question about barriers to certification. So Catherine, if you could speak to that.
So we feel with the subcommittee that we had, we feel that, let's say somebody does not have, maybe not have a whole high school education, right? Maybe they have a GED, but they can go through a training. They're excellent. They're already trusted in their community. And so that's a barrier. Other barriers, people who are coming home, formerly incarcerated people. Yeah, I see that history of incarceration. Formerly incarcerated people, some of them make great CHWs. That may stop them. That's a barrier for becoming one. So we decided at this time just to do standardized training. And I see Joe Calden says returning. I'm not looking at the chat, it was popped up, but anyway. I hope that answered. There's more, but you can always get in touch with me. I will answer anything, What ideas did you come up with will encourage employees to invest in CHWs? I don't know the answer to that. And I don't. So I can't answer that. What is standardized training? Standardized training is we use the core competence. We do core competencies. The C3 project that's been here, we use their core competence, and actually was one of the first fellows in that particular program to help to come up with a lot of the core competencies that we have. I don't know that I answered all. I hope I did. But if I didn't, I'll be here throughout the webinar. So yeah, thank you.
I believe we have, thank you, Catherine. That's great. I believe we have a few more minutes in your available time. Kayla, if there are questions that you want to relay
Sure.
to Catherine.
Yeah, I'm happy to do so. Lots of great comments shared, not necessarily questions, but I think some of these are ideas to encourage employers. So New England Public Health of Boston University offers CHW trainings online and does offer continuing education credits to become certified. That's an example. In Texas, a barrier for training is the cost, and so CHWs in Texas can be certified based on 1,000 hours of experience. And then ROI, just to clarify what that means, return on investment. Minnesota, they've chosen to do a standardized training, a certificate program in higher ed, not certification, and there were many reasons behind that, and it was CHW driven. So that's great. They do a check-in with this at the biannual state conference, and this model continues to be the preference of both CHWs and employers. Kim has shared, I'm not sure, Kim, where you're from, but they charge at the training site, but they're in the process of looking at scholarships, and they also work with individuals to pay when they can to help reduce that barrier. Joe, commenting on looking at medical systems and the profits that could potentially come from the communities they serve. And yes, a recording of today will be available. Thanks, Kim, you're from Texas. If certification is required, last comment here, I think is CHW should lead the certification program. Excellent point. So if you are having a certification program, making sure CHWs are a part of that actual certification process. Hawaii does not acknowledge CHWs, though several have completed a certification. Catherine, did you have a comment? We've got 3 minutes left here.
Okay, quick thing. I want to let you guys know that our subcommittee is 50% CHWs and 50% allies, and we always have CHWs at the table. And for our standardized training, we are saying that CHWs should always be a part of that training, be the ones to train. And quick thing, we also train employers. So I just want to throw that out there. Thank you.
Kayla, this is Carl. I'd like to jump in real quick. We're doing fun time. I want to acknowledge we are making note of the questions and comments you've raised, and it's good for us to know what you all really want to talk about. But I want to make sure, we would like to make sure, our panel would like to make sure that you have a chance to get questions answered about the process of assessing or surveying the CHW workforce in your state. A lot of what these questions amount to and comments are about specific areas of policy that you all are interested in. And of course, we'd love to talk about those as much as you all would. But our topic today is about the process of assessing or surveying the workforce. And we want to make sure that you get all of your questions about that process answered as much as we can. And so please be thinking about that, about questions that came for you during Catherine's presentation about how they did it in Louisiana. And we have another one coming up shortly. But before we do that, we want to turn to Caitlin Allen, our project manager, to talk a little further about how to actually use our resource center database to look for examples, materials about workforce assessment. So if I can turn that over to you, and Caitlin, if you want to introduce yourself briefly as well at this time.
Thanks, Carl. Hi, everyone. Thank you so much for joining. It's great to see over 150 of you here on this, I guess, Friday afternoon on the East Coast. I am located in Charleston, South Carolina, and I have been working as a project manager on this resource center project for the past year and a half. As Carl mentioned, I'm going to kind of do a quick walkthrough of use cases. So I want us to get a little creative here. And I'm going to give us 3 examples of users, and you likely will fit into one of these examples that might be coming to the Document Resource Center searching for CHW assessment related resources. Okay, so I'm going to ask Kayla to go ahead and just put in the Resource Center link so it's fresh on everyone's chat. And if you'd like, I would encourage you to follow along and try to go ahead and use the Resource Center as if you were searching for these types of resources. So the first use case that I want to share is let's imagine that you are a group that is planning to build a survey for the very first time to assess the community health worker workforce. And you are looking for examples of surveys or environmental scans to help build out this specific survey tool. So in order to do this, maybe you've heard about the wonderful state of Massachusetts, who has done quite a bit of work in the area of surveying community health worker workforce. And you can see here, and if you're on your computer and able to take a look at the Resource Center, you should be able to see on the left-hand side a filter search results. And you can actually go in and click on the state of Massachusetts and just look through all of the work that Massachusetts has done. You can see that the Resource Center actually has 34 specific resources for this state. Next slide, please. So I'm just gonna provide one example here. And there's a link at the bottom. Hopefully you are also able to find this if you're following along on your computer. But there is a CHW workforce survey that Massachusetts conducted in 2008. I'll go ahead and drop the link here as well. And so this is just an example of the type of resource that is available if you were seeking to find and build a survey. So you can actually go in using that link I just sent you, or if you've been doing it on your own, and click and see the survey itself, right? And you could get an idea of the types of questions that Massachusetts asked, which could help you to develop the questions that you might be interested in asking in your state. All right. Next slide, please. So I want to provide a second example here of a user scenario, again, for assessing the CHW workforce. So in this user scenario, you might be seeking to identify CHW workforce training needs. And so maybe in your state, the CHW workforce has been well established, but you're hoping to develop more opportunities to enhance the training that exists. And so for the purposes of this use case, as our example, we will use the keyword search for documents, okay? So if you are on the Resource Center, the main Resource Center landing page, there is a place where you can actually type in needs assessment, right? You could type in assessment, you could type in any combination of words, but since you're searching for a needs assessment, you can actually enter those words and it will search our database for needs assessments. Next slide. So you'll see if you type that in and search a number of different needs assessments. So I'm highlighting one here that might be relevant for the purpose of the use case I've mentioned, and I'll go ahead and drop that in here as well. this is, next slide. This is a needs assessment that was conducted in 2011. It's considered a national document, and it's a PDF that actually goes through the process that this group conducted when trying to identify CHW's training needs assessments. I pulled out one figure that could be particularly helpful for conducting a needs assessment. This was their study methodology. So it talks about the development of the study, how it was implemented, and then even the dissemination of those results. So again, just one example of the many resources that might be available if you were a user that was interested in conducting a needs assessment related to the training needs of CHWs in your state. Next slide. And then finally, the third use case is an example of a group that may be looking to apply for funding from a local organization to help assess the workforce at the state level. Okay, so maybe the state has done some work with CHWs, but is really seeking to do a more expansive assessment at the state level. And so for this grant, you might be interested in including some information and lessons learned from other states. So you're looking nationally, you're looking at kind of the national landscape as well as those other states, but particularly you want to put a section in your grant about what lessons have been learned and how you can improve on those for the workforce assessment that you're planning. So in this example, I want to show you the drop-down menu. And again, if you're on that main page on the left-hand side, you'll see different topics. And underneath the policy development process, you can actually go in and select lessons learned, which is clearly directly relevant to this type of use case and scenario. So next slide. There are a number of different resources that are available here in the lessons learned section. And these are just a handful of the examples that you may come across related, that might be relevant for that grant that you are writing for this use case. Next slide. Okay, you can back up. Hopefully this was sort of helpful in showing you more of a hands-on examples of how the CHW Document Resource Center could support efforts to assess the workforce. And I really encourage you all to explore the database and think about, or maybe you already have some specific things that you're searching for in assessing the CHW workforce, either locally or at the state level. So I will, I think I'm right at about time here. So if there are questions in the chat, I can type and respond, or we can respond at the very end. And I will go ahead and hand this over to Adrian Davenport from Michigan to share their experiences at the state level in assessing the CHW workforce.
Caitlin, just a comment that I don't see any questions directly in the chat, although I did want to comment, I did respond in the chat. You are able to download the documents, and that's kind of what Caitlin was screenshot and sharing with you all. So once you go to the site and you find a document, you click on it to read more, and it does have a button that says download. So most of the format will be in PDF. So you'll just have to get in there and look around. And since we have one more minute, I will take another question. How up to date is the information? We're working on that. A lot of the resources that were in there, I'll let Carl speak to it, but it's been several years worth of compiling the information. So Carl, do you have a time frame for us that would be helpful?
Sure. Yeah, most of the documents that are currently in the database are up through about 2018. Those documents were originally coded for the earlier studies that I mentioned. We have about 200 more that have been that are more recent. that we have just added to the database. They're in the process of being reviewed and published now, but they are fairly up to date. We do want to invite you, and there's a very clear message on the website. We do invite you to submit things that you think should be there, and also to send us a message saying, I heard about this, or I can't find it, or I would like to see more documents about X, Y, and Z. And please communicate with us about those as well. This is a cooperative enterprise. We can't do this without the help of our users. And so we do encourage you to submit that stuff. And just, I don't think we said this explicitly, but although all of us encourage you all to become members of NACHW if you are not already, either as an individual or as an organization. But the database, since it is has been federally funded, is not limited to members only, that anyone can use it. And so we do encourage people to do that. So I want to move on to turn this over to Adrian Davenport from the Michigan Department of Health and Human Services, who has some very unique experience in this area. Adrian, please.
Hi there. Yeah. Well, thank you so much for having me. It's just my name on here, but I am one of many. I'm giving this presentation from the standpoint of the state health department, but we couldn't do it without the partnership from our Michigan Community Health Worker Alliance, and many, many other partners. So I'm just giving the state perspective, but it's all because of partnerships that we're able to do this and to give this presentation. We are on the public health side of the Department of Health and Human Services in the Diabetes and Kidney Unit. Thank you. The types of assessments that we've done in the state of Michigan so far, we have three main types. First is an employer survey. And this is a kind of survey that's sent to both known employers of CHWs and past respondents of previous surveys. Also CHW surveys, which are sent to known CHWs. And in this first edition that we've just submitted, it offers the CHWs actually CEUs for completing the survey. And another fresh project in terms of assessments is we're taking part in something called the Common Indicator Pilot Project. What this is it's a national project that's supported by the CDC to give national assessment of CHWs, and we're pilot testing. We are actually only pilot testing one question. We're one of a handful of other states doing this. We're pilot testing a question that measures policy and systems change at the state level, and there are 9 different data elements to that. So next slide. A huge key to all the work that we do is partnerships. Our biggest, hugest, wonderful partner is the Michigan Community Health Worker Alliance, or MICHW, and they have many sub-partner organizations that they work with. They have huge expertise and wonderful connections. They are huge, huge partners for us. We also have other state health department partners. So at Michigan Department of Health and Human Services, I work in the Diabetes and Kidney Unit, and we work hand in hand with our Heart Disease and Stroke Prevention Unit. And also we work with the MICHW Policy Work Group and other work groups too, to make some of these assessments happen. And it's a connection in progress, but we are starting to connect with Michigan DHHS and Medicaid. And that's another huge partnership that we're really excited about. And actually some of our work with our Common Indicator project has brought us closer together and helped us knock down some of those silos. Next slide. I put together a little chart. It may be a little tricky to see here, but I can talk you through the basic idea of what this chart is. This is laying out our Michigan assessments and why we do them, what we're trying to go after, and just a few helpful notes that might help various people listening in, trying to figure out or compare or just kind of understand what we're up to help themselves. Our first type, our employer survey. The purpose is to gauge the CHW workforce, environment, employment status, funding, roles that CHWs play, and some other key topic areas. And it's statewide from an employer point of view. And this really informs advocacy work. It shows holes, it helps build connections, and it gives some really helpful data on these elements. A few quick notes about our employer surveys is NACHW is the one who actually undertakes the survey, so our Community Health Worker Alliance for the state of Michigan. And we've done these every other year or biannually since 2014, excuse me. And the results are in the Resource Center. We have them in this National Resource Center for you all. If you'd like to take a look, it's the final reports that's in the center. Next, our CHW surveys. Actually, this is a newer development for us. These also are meant to gauge the CHW workforce, environment, employment, role, education status, pay, but from the CHW point of view. And there are two different perspectives for sure. And we really want to hear the CHW's voice when we do these surveys. So this was the first, we just worked with NACHW to release the first statewide CHW survey in May, and we're really excited about that. And again, this can inform our advocacy work and really help us to understand what it's like for CHWs from their own voices. And in the notes, like I mentioned here, it's the first of its kind statewide for Michigan. We released it May 2021, and I believe the results are just being closed, or the survey was just closed, and results are being collected. We're in the process. So we're pretty excited about that. And our Common Indicator project, our national project, we're piloting just the one common indicator. There are 11, and we're just piloting the one. But along with a few other states, we're piloting the data for 11 national common indicators. And the aim is to move towards consistent CHW data collection nationally, which leads to so many other things and really helps advocate for the CHW profession as a whole and for us to be able to measure and to prove the worth of CHWs. And it's statewide about sustainability and policy is what that topic is for us. So it's kind of interesting. It's both collecting the data from Michigan, but it's also testing the test or testing the evaluation at the same time.
Huh.
So it's an interesting process.
Yeah, told one.
And let's see, we're participating just a few short months with this project. So it's May through June of 2021.
I'm at my house, yeah.
And the hope is that we'll help public health build connections with Medicaid in the state MDHHS. And it possibly could be built into the next 5-year CDC chronic disease grants. So right now with our diabetes and kidney unit and our heart disease and stroke prevention units in public health, we're funded primarily with 5-year CDC grants. And these grants direct the kind of work that we do and also directs the evaluation. So the hope is, I believe, that with this common indicator project, it'll affect the types of data that's collected the next round of CDC projects. Next slide. How we developed our evaluations. It was really led by NACHW, but with collaboration from many other partners. We at DHHS and the public health side, we supported it with our grant dollars. And it was a collaboration between NACHW, our public health groups, the NACHW evaluation work group, and other NACHW teams, some evaluation contractors. For example, we contract with an organization called the Michigan Public Health Institute and the University of Michigan School of Social Work, which is the organization that NACHW was sort of born out of, and some of our internal evaluators that we have on staff in public health at our teams. And to the extent possible, we tried to keep questions the same or similar to show change over time. Sometimes things had to be modified, but we tried to keep them as similar and consistent as possible. Next slide. There are things that worked well and challenges, of course, so far in our work. So what's worked well? Our partnership with MDHHS and NACHW and their partners has been wonderful and has been so fruitful and delightful. That's been a really, really good part of it. In our public health, diabetes, and heart disease and stroke prevention units, we've been able to use CDC grant funding to help fund some development, distribution, and evaluation costs. All of that's very expensive, and the CHW workforce and our Michigan organization, it's relatively new, and money is needed to help with some of these things. So we've been able to secure a little bit of grant funding to help get these things going. And so far, another positive is that we've had a large response rate to this first CHW survey, and offering CEUs seems to have really helped entice people. I thought that was a brilliant idea on NACHW's part. It really does tie into one of the core competencies in terms of advocacy and policy for filling out this survey. The last I checked, there were over 200 respondents of individual CHWs responding to the survey. So we'll find out the final numbers very soon from NACHW. Next slide, please. Challenges. Of course, everybody has challenges in this realm. Evaluation is expensive. It's very expensive. And it can sometimes be a struggle between trying to support some other aspects when we're giving funding of the CHW workforce and promoting salaries and being able to afford evaluation, proper evaluation that's really well done. Certainly related to that, the sustainability of surveys. As NACHW is now its own nonprofit and it's getting established, the MDHHS teams that I work on, we hope to continue to support this work, but it's not certain. There's no guarantee. And we're really driven by grant funding. Certainly identifying the universe of employers is really hard. There's no systematic way to identify current or potential CHW employers. And many employers don't even know they employ CHWs. Another big challenge is the length of surveys. We want data, but the length can be daunting. And some of the surveys end up being really long and a little bit overwhelming and may deter people from completing them. And certainly COVID effects. There have been a lot of furloughs and shifted focuses for CHWs and for organizations that employ CHWs. And certainly MDHHS is pretty siloed. We don't have very good direct connections between public health and Medicaid. And luckily, we've been able to kind of work slowly towards more connections. Okay, next slide. Michigan has 11 resources in the NACHW database, including employer survey reports. We've got update emails, study results, and more, so you can look for what we have. Next slide. And really quickly, just a quick note of some of our employee survey changes. We noticed from 2014 to 2020 with some differences. We increased our geographic reach. We started with 37 programs covering 11 of our counties, now 53 programs covering 75 counties. Like we've seen in some other presentations, more nonprofits are funding and employing CHWs, especially FQHCs. Our CHW count, while technically in our survey is down, we think it's actually gone up quite a bit. Our estimates are that it's much higher. Next slide. CHW pay has gone up a little bit, and our funding sources, while sustainability of the CHW workforce is a huge concern, there has been some progress made in the sustainability of CHWs in Michigan. There's a lot more opportunity, but there's been a little progress. Okay, and I think that's about it. Next slide. Okay. If you do have any questions, please feel free to reach out to me. And if I can't answer a question, I can get in touch with somebody who can. So thank you all very much.
Hey.
Yeah.
Thanks, Adrian. There are a couple questions,
Okay.
but I think let's wait until we hear from Carl about the translation report during our discussion time. So I've got them in the queue, or if you want to respond in the chat, you should be able to do so.
Okay, thanks.
Okay, Carl, thanks.
Great.
You're
Thanks,
on.
Kayla. And thank you, Adrian. This is Terrific. What I'm going to try to do in our last piece of presentation here, this is sort of our commercial. This is a message from our sponsor, which is the immediate reason for this webinar, the release of this report. And it is available through the policies page of the NACHW website. And I'm going to spend a few minutes talking about this, and I just want to reflect as I do so. I've been making some notes from our wonderful presenters from the state level experience, some things to look for, and if there are topics related to this that you would like for us to do some more digging to find documents, please do let us know about that. Okay, so next slide, please. The report itself is very brief. There's only 3 pages to it, really, plus references, of course. But we talk briefly about some of the national studies, going back to the groundbreaking National Community Health Advisor study in 1998. There has been a tremendous growth in the publication of documents, both policy-related documents and evidence-based documents, over the last 10 to 20 years. And the report also summarizes what we've seen in terms of what workforce assessment can do. You've seen some examples of workforce assessment efforts in 2 specific states, but also from Caitlin's presentation, some other applications of what the assessment technology can do. And then there are examples of both surveys and environmental scans. And environmental scans involve others like document review from within your own state, that sort of thing. And then some things that we have observed from looking at a lot of these kinds of assessments about how to be successful. And I'm going to be reflecting on a couple of things that I heard from Catherine and Adrian's presentations that. And then, of course, how to find related material. The report does give you some suggestions about how to find related material in the Resource Center. For example, the best way to find surveys is to do a keyword search for the word survey. So that's in a nutshell what the report is about. Now, I have said this earlier. Next slide, please. I have said this earlier, and I do want to reinforce this. It is very difficult for a project with a small staff to do a lot of our own searching for documents around the country. Some of the reports that we have in the database are not available online, but most of them are. And we really appreciate the efforts of various users around the country who have submitted their own studies or that have submitted a request for a particular type of study or something that they have heard about but can't find, and to see if we can help them find it. So we certainly encourage you to do that. There is a document submission window available when you and while we're on this call, by the way, if you have a suggestion of a document that you would like to share, please do not hesitate to do it right now while you're thinking about it. If you have a link to a study that you think we ought to know about, just go ahead and paste it in the chat window. If we already have it, no harm done. But if we don't, we will get it and add it to the database. If you have an actual file you want to put at the bottom of the chat window, there's a button marked file that allows you to upload a document, and we can get it directly from there. But what we're asking most people to do is to use the, in the Resource Center, there is a section on the landing page called How You Can Help. And one of the options there is add a document to the resource directory. And I believe there's a button to that effect on other pages elsewhere in the Resource Center. That brings up a window like the one showing on your screen right now, which is the title of the document, when it was published, a few basic facts about it. If it's a published article that has an abstract, you can just copy and paste the abstract right into that big window there. And then further down the screen, which we're not showing here, it shows the various filter selections that you can choose for those documents. So again, if something occurs to you right now, if it's not too distracting for you to find it and put it in the chat, we appreciate that. But otherwise, later on, at any time, please do submit a document. So I promised that in my closing presentation here, I would talk a little bit about what we heard from the presenters and how it relates to what to look for in the Resource Center. And here are some things I would like to share. We don't have these on a slide, of course, but please feel free to take notes, and I'll take my time reporting these. First, that there are different kinds of tools that you can use. Sometimes it's a survey instrument, and most of these are done these days, of course, online. And those are very popular tools. Keep in mind that not everybody among community health workers, not everybody has necessarily the same access to the internet that you would want to use. And sometimes it's useful if you have a lot of grassroots community health workers out there, promotores, who may not have the same level of access to the internet, to have a hard copy option available for them to fill out. And of course, depending on the language preferences in your area, that you may need multiple languages, that your surveys may need to be translated. And so there may be some opportunity for you to research those issues. There was in both presentations a mention of the key value and importance of partnerships, that there are various kinds of organizations, partnerships between a state CHW or alliance or association and the state health department is pivotal to that. But there are clearly situations, again, in both Louisiana and Michigan, where the involvement of academic institutions can be very helpful to your efforts, and they have been important in both of those. So looking for examples of partnerships may be helpful to you. How to fund this activity. It is apparent in quite a few states that chronic disease funding from the CDC has been pivotal to this. CDC is placing a lot of importance on community enhancing policy to support community health workers. And so in a number of states, the chronic disease funding, currently the 1815 and 1817 grants, are increasingly important in this assessment effort. There's a common issue, and Adrian went into some detail on this, how to identify employers. It can be a big challenge, particularly with potential employees. You don't know what you don't know. It's one way to look at it. You don't know who's out there who could be employing CHWs, who may not really understand CHWs themselves. You may not be aware of whether they're interested or curious about CHWs, but it can be a big challenge to identify them. You have the advantage if you do this on a regular basis, as they've done in Michigan, that you can include past respondents in your survey base. Okay, my video is disabled. That's okay with me, but in terms of identifying CHWs to survey, obviously, if you have a network or association or alliance, you can start with the membership of that alliance. Increasing number of states are establishing registries of CHWs. There are some states, I'm not aware of any that has actually established a registry of employers, which would also be very useful. But some states are establishing registries of community health workers, which can be helpful in seeking employment or in recruiting, for employers recruiting CHWs, to have an asset like that. But that is another resource, and we will, I'm not sure whether we have information on registries in the database now, but we can certainly add documentation of the states that have established them. Some, like Virginia, fairly new. And so that is another opportunity. And it has been the experience it has been the experience of a number of states that relationships with Medicaid are crucial, but they are not necessarily easy to establish. Some states have been pretty successful with it, but it is important to find out from state Medicaid officials, what do they want to know about the workforce? That can be very helpful in trying to build relationships with the state Medicaid program. So those are all some observations about things that you may want to look for in the database. But I, again, want to recommend to you looking to this assessment report, which was just published this week. And again, it is, if you go to the NACHW website and click on the policies menu, on the policies page, there is the this new report. There is one that was published back in October. Some of you may have been on our webinar introducing the translation report on sustainable financing. That is also available on that page. And we will be very soon releasing a third translation report about developing statewide training standards for standardized training. And this, again, is it's not about specific curriculum. It is about the process of defining and establishing statewide standards for training of CHWs. So with that, I would like to turn back to the chat and see if we have further questions
Sure,
for
Carl.
any of our panelists.
Yeah, this is Kayla, and I've been helping with the group today, trying to curate some of the questions that have come through. So I am going to start kind of at the top. So one of the questions that came through when Catherine was speaking was related to how do we utilize CHWs in every single community nationwide to really reach people all by utilizing them from within their own community. So again, what are some strategies or activities to get CHWs engaged in their own communities? That would be for anyone, I think, any of our presenters.
Hi, Kayla. I think over the years as a CHW, for me to be engaged is number one is you have to go out into your community. You have to talk to the people there so that they'll get to know you, you'll get to know them, and then you can talk about what's going on with them, about their concerns. All of that helps you to be a good community health worker in the communities that you're working with. I'm not sure if that answers your questions, but you know, people keep talking. I mean, and I understand about online, but when you have rural communities, sometimes online is not working because they don't have access to computers and whatever. So you really have to get out there, go out in the community. If you partner up with a different group that's doing something for that community, you could go that route too. So I hope that answered you somewhat, you know.
Thank you. I just want to add to that there may be some other ways to respond to the same question, and one of them has to do with from policy point of view. You know, how can you get policies that will make it possible for more CHWs to be active, available in the community? We have a long history of volunteer CHWs, promotores de salud, who have been doing the work, but I'd say there are a number of essential things to look at. One is, and we've heard this as the theme from our presenters, I want to reinforce this as well. There are a lot of folks in any given state who really don't understand community health workers, and it's very hard to make progress in expanding the reach of CHWs and their impact if people don't understand what community health workers, who they are, what they do. And that is still a big challenge. I've been doing this for 25 years, and I'm continually amazed at the lack of understanding in places where people should understand. We're making progress, no doubt about it. The other is, which is related to it, is the lack of a solid ongoing base of sustainable funding for CHW positions. We're reaching out a lot to Medicaid. As we've said here before, that this presentation is this webinar is not about financing, but financing is a crucial ingredient. And if we can gain acceptance from a program like Medicaid or from block grant programs for social services or community development, and really get in the pipeline for those types of funding, that's going to make a big difference in terms of expanding the reach of CHWs.
Thanks, Carl. And there were some ideas in the chat there of, you know, going and just putting yourself in the community and becoming a part of it. So thanks for that comment, Charles. Another comment or question that came through, one question from Nicole, she's with CDC. I'm looking at assessing CHWs directly. Ideas on how we can build evidence base for the effectiveness of CHWs and working in local communities. So if we were to require evaluation of CHWs by recipients who work in the communities, could the Resource Center help with that? I think that's a great question, Nicole. I actually will try my hand at that. And then maybe Adrian can speak a little bit more to the Common Indicators. But the Common Indicators project is certainly a way that is looking at evaluating CHW's effectiveness. And there's still a lot of work to be done. We're in a piloting process with that now, but that would be my first initial reaction to that question.
Yeah, it is a great, very important question. And we do, I want to reinforce what we heard today from Adrian about common indicators. I dropped a link into the chat a while back, how to find out more about common indicators. It will be very helpful the more we can start using similar methods and measurements or metrics in evaluation of programs and in research studies. If we use a common set of measures, it's going to be easier to compile those results and to compare results from one place to another. So I certainly want to recommend that. But I think it's helpful for funders of services involving CHWs to be willing to invest a portion of the money in sound evaluation. We always used to say if it wasn't documented, it didn't happen. So I think that's an excellent point.
Yeah, and if you want, I can give you some ideas of the types of questions that are being looked at with the common indicators. So we are looking, the project is looking into CHW job satisfaction, pay or compensation and benefits, how the CHW feels valued to an organization, and supervision too. How often CHWs take part in the 10 core CHW roles, and their trust and satisfaction with the situation that they're working in. Also, connections and engagement with decision and policymakers, and extent to which CHWs are integrated into teams, like for example, healthcare teams or collaborative teams, and some training questions, even psychological safety or support, and policy and systems change. Those are some of the types of questions that we're testing.
Great, thank you, Adrian.
Thanks, everyone. And we have a few minutes left, so I do want to try to get to some other questions that have come through. One question related to surveys. So have surveys usually been web-based, or if there are other strategies that have been used to reach CHWs for workforce assessments? I think that's a great question. So again, have surveys usually been web-based, or how else are you reaching out to CHWs or organizations that utilize CHWs for workforce assessments?
In Michigan,
feel free to comment in the chat. Mm-hmm.
Oh, sure. Yeah, I can comment in the chat.
Oh, no, Adrian, you go ahead. I'm sorry. I meant our panelists for sure comment, but if anyone else has ideas, please use the chat.
Sure. In Michigan, it's been mostly electronic.
In Louisiana,
go ahead.
In Louisiana, it's been electronic.
There are some examples. I know, this is Carl, that there have been some concerns about, as you mentioned, Catherine, about availability of internet in some places, but that some organizations have been including distribution of hard copy surveys, handwritten. Again, they also need to be short if people are really going to respond to them, but to distribute them through employers or at community events. And there are, quite often, let's say, periodic meetings of CHW associations, which back in the good old days used to be face-to-face, that you can certainly do that. There may even be some ways with associations or organizations that are having virtual meetings, Zoom meetings like this. You can do polling, short polls, in the Zoom meeting itself, which can be very helpful. And again, another plug: the NACHW annual meeting and Unity conference at the end of July. Information is on the NACHW website, but that there may very well be some some online polling of participants during that event, and that could be hundreds and hundreds of people. So there's some things that you can do in various innovations with it. But my suggestion is there may always be a need for a hard copy option for people to respond.
Thanks for the comments and discussion there. There's lots of great questions in the, or comments to this as well about what's been done in the chat. So there's also some web-based, and then taking that same web-based survey and just making it a paper form and doing it that way. And then even mailing letters. So lots of different ideas and options. Another question that came through speaks to the state registries. So if you don't have a state registry for CHWs, how would one go about starting that? Or are there other ways to collect that type of information?
If there's anybody on the call who has experience with that in your state, you want to type a few notes or give a link in the chat, that would be great. I will say that there are a couple of different models out there. There are official state-sponsored registries, which can be organized, let's say, by the state health department or by, there are 4 or 5 states now that have independent certification boards for CHWs. And that brings up one of the other options as to whether the registry is only going to be certified CHWs if your state has certification, or whether it's open to others. The ones I'm familiar with, any CHW can enroll in the registry, and you do not have to be certified in order to do that. I would certainly recommend going that direction, but it can be organized by the state health department. It can be managed by another association like the State Public Health Association. It can be operated by the state CHW network or association or alliance itself as a private entity. And you just need to think through what issues people will have with the privacy and confidentiality of their data. A registry is typically kind of a public document. In other words, if you want employers to be able to search in the registry when they're hiring, then it's not going to be very confidential information. But those are some thoughts about how to establish it.
Thanks, Carl. And other folks have been commenting on some of their experiences as well. So thanks for that. Okay, I think we have 2 minutes left. So one of the questions that came through that was addressed in the chat, but I did want to call it out. Are there surveys of CHWs that ask about desirability and availability of training in occupational safety and health, and so that CHWs could help clients? And the response given there in the chat, well, I think that was a direct chat, but I thought that was a good question.
This is Caitlin, and just as an FYI, Massachusetts has asked those specific questions in previous surveys, and Gail Hirsch, who I know is on the line, is able to probably share some more information about that if those specific resources aren't there. But that type of question, they worked with their occupational health and safety division at the Department of Health.
Yeah, that's a great question and very timely, obviously, for CHWs themselves in a pandemic situation. Their own their own safety is really paramount. But as many of you know, a lot of folks work directly with agricultural workers in many parts of the country. It's not just California and Texas for sure. And the occupational health for that population is of paramount importance. And so it is a very timely topic. So we're just about out of time. Any of our panelists want to offer last thoughts before we close?
No, thank you for having me.
We thank you, and thank you, Catherine, for joining us.
Yeah, thank you. I hope I'm sitting here listening to all this. My one thing's in my head said the presentation could have been a little bit longer, but I think it had the information that was needed. So, you know.
Sure. There's always opportunity for follow-up. So,
All right.
And we didn't really get a chance to thank Kayla, and Kayla is directly involved in the project on behalf of the National Association of Chronic Disease Directors, and we thank you for your support of the process today.
No problem. Happy to be here to support everyone. And I think, Bernadine, we said the recording and presentation materials will be available.
Yes, absolutely. So keep an eye on your inboxes. Next week, we will send out the presentation in PDF format along with direct links to the report. And we will also be uploading this to YouTube. So we'll make that link available to everyone as well.
Great. Well, thanks y'all for joining us, and have a wonderful weekend. And please be in touch if we can be of further help to you and folks in your state.
Thank you, everyone. Have a great weekend. Bye.